Hi everyone, this is Cheryl Skolage and Kelly Maynard with another Lipedema Lite Bite. Today we're going to be going over Lipedema Stages.
I'm Kelly Maynard with Wild Heart Wellness, and I'm super glad to be here to talk about stages. There's a lot of confusion, so we're really excited about this topic.
I'm Cheryl Skolage, Lipedema Diva, and I'm really excited that all of you have decided to join us for this new presentation. So we'll get started.
All right, go ahead.
They've recently updated and decided that we are going to say that there are 3 stages. I'm sure a lot of you have heard, some people say that there's 3 and some people say that there are 4 stages. And it has been decided that we will be going ahead with 3 stages of lipedema. The 4th stage was the involvement of lymphedema. But they found through research and looking at a number of people that lymphedema can occur at any stage. So instead of calling that stage 4, they've decided that they will classify lipedema as stages 1 through 3, and then give you the additional classification of lipo-lymphedema if that is so.
Correct. And we do need to note that if you're in another country besides the US, your country may still be doing 4 stages. Your country may be doing 3 stages. So our information today is going to be looking at what we've decided here in the US according to the people who are trying to write the standards here and come up with more clear distinctions for the different stages that we have. But you also need to kind of understand that this is really recent. So some research you read or some previous webinars or anything like that, if they refer to stage 4, it means that you also have lymphedema in addition to lipedema.
Correct. And so as you can see from the picture here, that the stages can have a very different appearance. So the first picture is a stage 1 type 2 person, and the center 2 pictures are both stage 2. One person has type 2 and one person has type 3 lipedema. So you can see that the appearance can be very, very different with the same stage. Stage 3 is the last picture there, and that person has type 3 columnar legs as well. So last time we talked about the types, and that's where the lipedema deposits. The stages are more about the appearance and texture and feel of the skin itself.
Right. So we see like the stage 1 person doesn't seem to have a lot of that texture of the skin. It's more smooth, and it progressively gets, I guess worse is not a good word to use, but it as you go through the stages, the skin texture and the fibrotic tissue are all changing, and that's how they determine the stages. It doesn't really have to do with where on the body it is. Like Cheryl said, that has to do with types, which we did a video on types if you need more information on that. We have some great examples here in just a minute.
Yeah, this will really help out a lot.
Yeah.
Stage 1, the skin has a lot of cellulite, and so they're also calling that orange peel. We talked a little bit about that in the last video as well. And so there's going to be some dimpling of the skin, and there might be a slight disproportion in the size of the affected areas. So your legs will be a little bit larger than your upper body. Your upper arms might be a little bit larger, but in stage 1, that's typically pretty slight. Sometimes it's very difficult to be able to detect lipedema in the early stages And kind of one of the reasons that we're doing a lot of these videos to raise awareness so that more stage 1 ladies can get diagnosed early so that they can start proper treatments early as well.
Right. With stage 2, we're going to notice instead of just a slight orange peel look with like maybe looking more like cellulite, there might be larger bumpy areas of the skin, greater sort of dimpling of the skin. There will be more disproportion and size in your affected areas. So as you can see from the stage 1 and stage 2 pictures, they're kind of the same shape, but the hips and thighs and calves on the second picture are just bigger. And the texture of the skin is going to look a little bit worse because underlying connective tissue has gotten more distorted and is not as healthy in stage 2.
I've heard stage 2 kind of called like a mattress effect. And so the dimpling almost looks like a mattress.
Yeah, I've heard that too. And I think some people might think, well, what does that even mean? It's, if you think about a mattress, it's where they do the sewing, like the tufts where they pull down the mattress to sew it. It has like a smooth part and then a little dip, and then a smooth part and a little dip where they pull the thread underneath to sew it. And so I've noticed we've seen a lot of pictures lately of women with stage 2, and it does kind of look like that. It'll be some normal skin and then deeper kind of divots or little depressions in the skin where it's distorted underneath.
Yeah. And then stage 3, there's even more deformities and flaps of the skin. So this is where you'll start getting some, I think they describe them as lobules of skin starting to form. And then stage 4, which we're not really calling stage 4 anymore, but the Lipo-Lymphedema, you're starting to get that excess fluid retention, so that lymphedema of the fluid is starting to also be retained in those areas. So if you go back to some of the earlier videos, we talked about pitting edema. And so lipo-lymphedema will have that pitting edema, where if you press on the skin, that depression will stay there for a little bit until the fluid returns into that area.
Right. And this slide does say you'll have the same characteristics as stage 3, but even if you have stage 1, you can still have a secondary lymphedema. And as Cheryl said, if you're like stage 1, the only thing that might kind of clue you in that you might have lymphedema could be that your feet are also involved, because that'll be an indication that you have fluid in your feet, and the pitting edema can occur. So if you're having swelling in your feet or your hands, that is not a normal thing if you just have lipedema. So you'd want to get that checked out no matter which stage you're at, 1, 2, or 3, and make sure that you're not having a secondary lymphedema as well. Did you want to, oh, I guess this up at the top, it says the level of pain each person feels varies depending on your nervous system and your pain threshold and those type of things. And it's interesting because I think I've talked to a couple people in the past week or so, and they thought that as your stage progressed, your pain level also increased, but that's not always the case.
Yeah, that's very true. I've heard of some women who are stage 1 and they have a lot of pain, and it can really vary quite a bit. So it doesn't necessarily progress as stage progresses. And did want to mention our previous photograph was from Dr. McHutchinson's publication, and this particular one is from Daniel Lipedema, Chile, and he's on Instagram.
Our stage 1 ladies, Some of you may look at the first picture and say, well, that doesn't even look like lipedema. And that's part of the problem that women with stage 1 run into if they go to a doctor and they say, I have all this pain, or just something's wrong. And the doctor will say, oh, you're fine. You just need to go back and exercise. Or even the second woman, she has a little more of the pear shape than the first picture. But I think if we look closely at these women, maybe we can tell a little bit about how lipedema shows up in stage 1 with their knees, and maybe some of the ways the
inner thigh fat pad.
right.
You can see that there. It may be some of those fat pads around the knees that we were talking about in the last training. And you can kind of see a difference between the size in the second person, the difference between the size of the thighs and the hips. And so that's an indication as well that there's some swelling and growth in the thigh area there.
Right. And even in stage 1, we can't look any closer at these particular pictures, but even in stage 1, women will have those little fatty deposits around the ankle. So that's important. And you can tell the first woman, her skin looks fairly smooth. Mm-hmm. And so that is even more difficult when women go in and they look normal. The second woman is starting to get a little bit of cellulite looking, for lack of a better term. It's not really cellulite, but that's kind of what people have in their mind of what it looks like to them. So stage 1 can be really tricky, and I mean, we do need to try to diagnose earlier so that these stage 1 women can get the help that they need.
Here's some examples of stage 2. You can see that the texture of the skin is starting to change on a number of these women. The first picture, you can definitely see that inner thigh fat pad. And the picture isn't great, but you can see on, let's see, on the right-hand side, you can see a little bit of dimpling right below on the hip. Mm-hmm. The other 2 pictures, you can see a bit more of that texture, and so you can really start seeing that difference.
You can, and like the middle picture, the legs look more like that column shape. Mm-hmm. And you can see the outer ankle has a little bump there. So if we really start looking closely, we start noticing all those symptoms of lipedema. I mean, at first glance, it's kind of hard, but if you look closely, you can see. None of these pictures have a well-defined kneecap, so that's another indication. And you glance at them and they all look different, but they're all stage 2, and they do have similar characteristics if you start looking specifically at those things we talked about in the types video that we did. So I think that's so interesting that there's such variation in one stage of lipedema, and yet commonalities as well.
Yep, very true. And here's some stage 3 ladies. You can see some of the fat pads around the knees, some fat pads around the hip area, and so you can see those lipedema areas.
That's right. And one other thing, it's easier to see on women who have stage 3, but there are stage 1 and stage 2 women also who have some lipedema in their abdominal area. And
that's a really good point.
Yeah,
yes.
So it's easier when the women reach stage 3 to see, but I've talked to stage 1 women who have this weird thing going on with their abdomen, but they've been told lipedema doesn't exist there.
Right.
They've been told it's only if your thighs are big, you have lipedema, and that's the end of their story with the doctor or whoever they talk to or the article they read online. But you can tell on these women, if you look closely, the abdominal area texture is similar to the texture on the legs.
Yep.
So I think that we need to be careful assigning specific body shapes and types to who has lipedema and who doesn't, just based on a picture that you see online.
Yes.
That can be dangerous.
Yeah. I know a number of people who have gone to the doctor, and the doctor just has that one picture in mind,
Right.
of lipedema from the hips straight down to the ankle with a definite ankle cuff. And if you don't match that picture that he has in his mind, then that's it.
Right.
And as you can see from the videos that we've been doing and the various pictures that we have, there are many, many different shapes for lipedema.
That's true. And to comment on what you just said, I've talked to women who, since they don't have the ankle cuff, they've just been completely dismissed.
Yes. Yep.
Because and even a lot of lipedema groups or lipedema websites, most of the pictures will show the ankle cuff, a very definite ankle cuff.
Yeah.
And so I think that's a little bit confusing sometimes, because a lot of women who do not have the full leg lipedema, who it only goes to the knee, they won't have that ankle cuff.
Yep.
Or maybe in stage 1, it's not such a distinct ankle cuff. It may just be that right above your ankle is a tiny bit bigger than your foot. So we really need to start looking at women individually and not rely so much on the common 1 or 2 pictures that seem to be circulating and 1 or 2 ideas that we have in our mind of what lipedema has to look like.
Very true. And Lipo-Lymphedema, so this was previously called stage 4. It's a combination of both lipedema and lymphedema. It often occurs in later stages, but it can actually occur in any stage. And in this, when this occurs, your feet are involved. So that's a really good way of realizing if you have that lipo-lymphedema.
Right.
And for more information, contact us. My website is lipedemadeva.com.
And mine is wildheart.health, and my email is info@wildheart.health.
We have 2 Facebook groups, one for patients, lipedema and food sensitivities, take control of your lipedema. And for health and wellness providers, we have lipedema and food sensitivities healthcare community. So we hope to see you guys there, and see you next time on Lipedema Lite Bites. Thanks for joining us. Bye.